Infectious diseases of the respiratory system, common cold, viral sinusitis, and respiratory syncytial virus. Lower and upper respiratory tract infections are among the most common diseases in humans caused by viral infections such as the common cold, sinusitis, and respiratory syncytial disease, RSV. Viral respiratory tract infections can range from benign to life-threatening. RSV is a viral respiratory tract infection that can lead to lower respiratory tract infections and diseases such as pneumonia and bronchiolitis. Although RTIs can cause lung damage, they do not spread beyond the lungs. A viral infection of the respiratory tract is the common cold. The common cold is an acute, self-limiting viral infection of the upper respiratory tract involving the nose, sinuses, pharynx, and larynx. The viruses invade through upper respiratory tract openings through the ocular mucosa. Viruses enter your body through your mouth, eyes, or nose. The common cold usually resolves within 2 weeks. Rhinoviruses cause the great majority of respiratory illnesses. Symptoms are caused by more than 200 viral subtypes, rhinovirus being the most common. Approximately $17 billion is spent on direct medical costs, over-the-counter medication, and $22.5 billion in indirect costs, lost workdays a year. The common cold is the most common acute illness in the U.S., responsible for approximately 37 million ambulatory care visits each year. Upper respiratory tract infections, nasal congestion, throat complaints, and cough are responsible for 11% of general practice consultations in other Western countries. Most infections occur in the winter period. Symptoms which generally relate to the infected mucosa typically peak at 1 to 3 days and last 7 to 10 days, although they occasionally persist for 3 weeks. The virus is spread by hand contact with secretions from an infected person, direct or indirect, or aerosol of the secretions and virus. Incubation period varies but is just under 2 days for rhinovirus. Symptoms are mimicked by other viral pathogens at the onset of the infective cycle. The respiratory syncytial virus, RSV, influenza, and early stages of rubella and rubiola infections. Symptoms of the common cold are runny, stuffy nose, sore throat, cough, congestion, slight body aches or mild headache, sneezing, low-grade fever, generally feeling unwell, malaise. The discharge from your nose may become thicker and yellow or green in color as a common cold runs its course. This is not an indication of a bacterial infection. When to see a doctor? For adults, seek medical attention if you have fever greater than 101.3 degrees Fahrenheit, fever lasting 5 days or more, or returning after a free fever period, shortness of breath, wheezing, severe sore throat, headache, or sinus pain. For children, in general, your child doesn't need to see the doctor for a common cold, but seek medical attention right away if your child has any of the following: fever of 100.4 degrees Fahrenheit in newborns up to 12 weeks, rising fever or fever lasting more than 2 days in a child of any age, symptoms that worsen or fail to improve, severe symptoms such as a headache or cough, wheezing, ear pain, extreme fussiness, unusual drowsiness, or lack of appetite. Diagnosis: clinical signs and symptoms. If the doctor suspects a bacterial infection or other condition, he or she may order a chest x-ray or other tests to exclude other causes of your symptoms. Common cold treatments are pain relievers, acetaminophen, aspirin, decongestant nasal sprays, cough syrups, fluids, and rest. Viral sinusitis. Viral sinusitis is a common viral infection of the upper respiratory tract. Viral infections spread to the upper airways, causing inflammation and congestion of the sinuses. Mucous membrane in sinus cavity becomes inflamed. Passages that connect to the nasal cavity become narrow and impede the flow of mucus. Viral sinusitis usually resolves on its own. Approximately 0.5% of all upper respiratory tract infections are complicated by sinusitis. It is much more common in adults than it is in children, whose sinuses are not fully developed. Acute sinusitis is the second most common infectious disease seen by general practitioners. Most acute sinusitis is caused by the same viruses that cause the common cold. The most common cause of acute bacterial sinusitis are from the bacterium Streptococcus pneumoniae and Haemophilus influenzae. Complications from acute bacterial sinusitis are very rare. Causes of sinusitis are viral infections such as the common cold, allergic rhinitis, small growths in the nose called nasal polyps, a deviated septum, allergies, illnesses from other kids at daycare, pacifiers, bottle drinking while lying on the back, and a smoke environment. Acute symptoms of sinusitis are facial pain or pressure, headache, stuffed up nose, runny nose, loss of smell, cough or congestion, fever, bad breath, fatigue, and dental pain. Chronic symptoms are the same as the acute symptoms, they just last 12 weeks or more. Viral and bacterial sinusitis is determined by your doctor. A viral sinus infection will usually start to improve after 5 to 7 days. A bacterial sinus infection will often persist for 7 to 10 days or longer and may actually worsen after 7 days. Sinusitis diagnosis involves checking for tenderness in the nose and face. Doctors will also use other methods for diagnosing chronic sinusitis. These methods are nasal endoscopy, imaging studies such as a CT scan or MRI, nasal and sinus cultures, and an allergy test. Sinus treatment include decongestant and saline nasal washes, antibiotics, a vaporizer, warm compresses, and steroids. Other treatments are avoid triggers linked to sinusitis. For allergies, use antihistamines. For fungus, use antifungal medicine. And for immune deficiencies, use immunoglobulin. Untreated sinusitis can lead to meningitis, a brain abscess, or an infection of the bone. Respiratory syncytial disease is a viral lung infection caused by the respiratory syncytial virus. It's an enveloped, negative-sense, single-stranded RNA virus of the Paramyxoviridae family. The RSV derives its name from the fusion of adjacent infected cells into a syncytium, a giant cell containing many nuclei. Cell fusion is caused by viral proteins that travel to the infected cell's membrane, causing fusion of membranes between neighboring cells. RSV is the leading cause of lower respiratory tract infections in infants and young children. Each year, 4 to 5 million children younger than 4 years old acquire an RSV infection, and more than 125,000 are hospitalized annually in the United States because of this infection. Approximately 40% of all primary RSV infections in infancy result in lower respiratory tract infections, principally bronchiolitis and pneumonia. Pathologically, the inflammatory process causes edema of the bronchiolar wall, mucus plugging of the airways, and necrosis of the respiratory epithelium, which may have short and long-term effects on lung function. RSV causes at least 90% of all childhood bronchiolitis and up to 40% of all pediatric pneumonias. Approximately 2/3 of all infants are infected with RSV during their first year. 1/3 of those infected develop lower respiratory tract infections. Symptoms of RSV are fever, chills, dry cough, chest pain, respiratory wheezing, congested or runny nose, sore throat, and mild headache. RSV symptoms in severe cases in infants include poor feeding, unusual tiredness, lethargy, irritability, hypoxemia, cyanosis, and apneic episodes. RSV transmission is spread from person to person. It is also spread through respiratory droplets, through sneezing and coughing. The respiratory droplets enter the mouth, eyes, and nose. Who's at risk? Premature infants, young children who have congenital heart or lung disease, children with weakened immune systems, such as those undergoing chemotherapy or a transplantation, infants in crowded childcare settings, older adults, adults with asthma, congestive heart failure, or chronic obstructive pulmonary disease, people with immunodeficiency, including those with certain transplanted organs, leukemia, or HIV/AIDS. RSV diagnosis involves a clinical representation. Other viruses such as adenovirus, influenza, and parainfluenza can cause similar signs and symptoms of RSV. RSV requires a definitive diagnosis, isolating the virus from patients' respiratory secretions collected from the nose, throat, bronchi, or lungs, rapid viral testing, rapid immunoassay, which is an application based on immunoprecipitation that measures the concentration of an antigen, PCR, polymerase chain reaction, DNA amplification technique to detect specific pathogens, and serology tests. Serology is the branch of immunology that reveals the contents of serum, measuring the concentration of antibodies and antigens. This test is not good for infants. Presence of maternal antibodies is likely to result in a false positive. RSV treatment is, for infants and children, hydrogen-oxygen bronchodilators, palivizumab, a monoclonal antibody to F surface glycoprotein of RSV. Scientists are working to find a nasal spray vaccine to protect against the respiratory syncytial virus. For adults, supportive therapy, FDA-approved nucleoside analog ribavirin as indicated. Ribavirin inhibits RSV replication and is used to treat severe cases, but contraindicated in pregnant women. In summary, viral respiratory tract infections cause diseases such as the common cold, sinusitis, and respiratory syncytial disease, RSV. They are among the most common diseases in humans. Infants and young children are more susceptible to VRTIs than adults. People who are immunocompromised are more susceptible to VRTIs. Viral respiratory tract diseases can be benign to life-threatening, causing lower respiratory tract infections and diseases. There are no vaccines for these viral respiratory tract diseases. Diagnosis of VRTIs involve clinical symptoms and clinical presentations. Treatments for VRTIs are mainly supportive with the use of antibiotics and/or steroids if it is necessary or warranted. This concludes my presentation on viral infections of the respiratory system, the common cold, sinusitis, and RSV.